Welcome to this video, and in this video we are going to look at some of the recent updates from CDC regarding the coronavirus. So let me start by sharing my screen. Okay, I have shared my screen. Okay. There are new variants that have recently come up in regarding discussions about the Delta variants virus, which constantly undergoes various changes in the genetic sequence. So some of these changes may be quick, and some of these changes may be slow, and there are certain new variants which has increased virulence, or the infective capacity of that virus is much more higher as compared to other variants which could be less virulent. And the more the virulent a virus is, the less the efficacy and the potency of the vaccine to that particular strain of the coronavirus becomes. Mhm. Vaccines continue to reduce a person's risk of contracting the coronavirus that causes the COVID-19, including this variant. Vaccines are highly effective, particularly against severe illness. So, in coronavirus, you have three types of illnesses. One is the mild, the other one is the moderate, and the last one is the severe form of the virus. So, around 5% of the people who contract coronavirus tend to develop severe form of virus, and in that severe form of infections, the vaccination tends to play a positive role, especially against delta and delta plus variant infections, which has a higher tendency to spread faster and which are much more infectious than its predecessors. Top things that you should know: variants are always expected. So you can take the example of the flu virus. It constantly mutates, and that is why we have to have a new flu vaccine shot for every year. Similarly is the case for coronavirus. The best way to slow the emergence of new variants is to reduce the spread of the infection and protect yourself. So what are the ways you can protect yourself? Is through vaccination, is through face masks, and but however the efficacy of the vaccine tends to go down after 6 to 8 months, depending upon the type of vaccine that you're getting and depending upon your immune status. And there are so many other causes. So it is basically multifactorial. Vaccines can keep you from getting sick and being hospitalized, or in worst case, being morbid, or mortality rate is also reduced as well. So all COVID-19 tests can detect all variants, but they will not tell you which variant you have. There has been a recent development of the rapid tests for coronavirus variants, and in these tests, what really happens is you can detect the virus, which is going to take around 5 to 10 minutes using the swab around, just like how you prick your nose. It is not going to be something that goes deeper into the very interior parts of your nose, but it's a relatively shallow one, and you can get the results pretty quickly. However, the sensitivity and the specificity of those tests are pretty limited as compared to other much more sensitive tests like PCR, for example. And FDA has approved or authorized coronavirus vaccines to protect against the Delta and other known variants as well. These vaccines protect people from infection and severely ill, and significantly reduce the likelihood of hospitalization and death. We are not yet sure how the effectiveness of the vaccines will be against the new variants, but generally, if a virus mutates, the efficacy and the potency of a vaccine tends to go down. Symptoms. So let's go to the symptoms. And people with coronavirus have a wide range of symptoms reported, ranging from, it could be mild symptoms as well as a wide variety to severe symptoms, and usually they could appear from 3 to 14 days after the exposure to the initial contact of the virus. So the common symptoms include fever or rise in body temperature. The normal body temperature is 98.4 degrees Fahrenheit. If there is an elevation or rise in body temperature beyond this particular level, then this is termed as fever, and there is cough, SOB, or shortness of breath, and difficulty in breathing, pretty much the same. And generalized a sense of tiredness, you feel myalgia or muscle ache, body pains, and headaches, depending upon if it involves the anterior parts of the nose, or and you can have headaches as well. New loss of taste and smell sensations. Yes, if it involves the olfactory nerve branches, then taste and sensations could be temporarily lost as well. And sore throat. There is irritation and inflammation in the back of your throat, and there could be congestion or runny nose as well. Nausea or vomiting. Nausea is actually a sensation of vomiting, whereas vomiting is the actual act of uh, elimination of the undigested food particles through the mouth. Expulsion, it is caused by antiperistalsis, so it is just the opposite of what happens when you eat food. And diarrhea or loose stools as well. Okay. That's it for this video, and we'll see you in the next video.